Hello and welcome to the NABCA webinar, Unraveling the Mystery of U.S. Alcohol Regulation. Before I introduce our speaker, Pam Erickson, I wanted to address a few housekeeping notes. This webinar is one of a series of several planned through 2019. Another webinar addressing the increase in alcohol-related emergency room visits with Dr. Aaron White of the National Institute of Health is scheduled for April. There is also one being planned for September with the TTB. Now back to today's webinar. It will be about an hour. If you have a question, please type it in the chat window in the lower right corner of the screen. At the end of the presentation, I will come back and ask the questions for Pam to address them. The presentation is being recorded and will be available through the nabca.org website within 7 to 10 business days. You will find it under the Resources tab. I'd now like to introduce Pam Erickson. Pam is a passionate leader on the alcohol issues. Currently, she owns Public Alcohol Management, which operates an education campaign for a healthy alcohol marketplace. From 1996 to 2003, she directed the Oregon Liquor Control Commission, which included operating Oregon's distilled spirits business. From 2003 to 2007, she worked at Oregon Partnership to direct statewide leadership and media campaigns to reduce underage drinking. Her education campaign is designed to explain the purpose and objectives of alcohol regulation in simple terms. She has developed several reports on deregulation in the United States and the United Kingdom, and the United States, and biennially produces a report for policymakers called issue briefs. These reports explain how deregulation can lead to increased social problems such as high rates of underage drinking, public order offenses, and alcohol-related diseases. Recently, she launched a series of short reports. The latest one is entitled Special Rules for Small Breweries, Wineries, and Distilleries. Pam has also served as an expert witness in key alcohol regulation cases in Kentucky and California. Her educational materials are available at www.healthyalcoholmarket.com, and everything is spelled out, healthyalcoholmarket.com. Note that everything in the web address is spelled out, healthyalcoholmarket.com. All right, Pam, I am going to turn the webinar over to you. Just give me a few seconds to do the screen sharing. And I am going to change presenter. So if you can pull up the slide presentation, we should be good to go.
Okay. I think we are ready.
Okay, so I have, I'm going to take controls back for a second because I'm not seeing the presentation. I'm going to take control back. Okay.
It's up on my screen.
Okay. So I'm not seeing it on my side. I keep seeing the other document. Okay. So let's see what we can do here. Hold on. Okay, Pam, I think we are good to go. I can see everything, and so the webinar is now yours.
Okay, thank you so much. It's my pleasure to produce this webinar for all of you because I know there's a lot of confusion about alcohol regulation. And so I'm going to attempt to unravel the mysteries of this regulation for all of you. This screen just gives my basic information. And like Maggie said, my information is all available on the healthyalcoholmarket.com website. It's all free. You can download it, send it to whoever you want. You don't have to ask my permission. So let's talk about why alcohol regulation is somewhat mysterious to most people. And I think I'm kind of a good example. Before I became the director of the Oregon Liquor Control Commission, I didn't really know a lot about alcohol regulation. And I have to say that some of the regulations seemed a little silly to me. And part of the problem is that a lot of times we think about alcohol regulations as single regulations, whereas it's really a part of a system. For example, closing hours are usually around 2 a.m. And that's one of many, many regulations. Other regulations may not make sense until you look at the whole system. And so I'm going to try to explain to people why we regulate alcohol the way we do. What is a control system? Why is it different from a license system? And why do we have something called the three-tiered system? A lot of the answers are in our history. And so I'm going to trace the history of alcohol use in our country from the beginning. And the reason we do this is that if we can't remember our past, we are condemned to repeat it. That's a very commonly quoted piece of wisdom from George Santayana. Our history starts with the first wave of immigrants that came to our country. The first wave came from Europe, which had a culture of very heavy drinking. And so these immigrants brought their culture of heavy drinking, plus some of their products. Alcohol consumption was very, very high, probably about twice as much as it is today, according to historians. And people had habits like, if you were a worker, oftentimes you had breaks at 11 a.m. and 4 p.m. for the purpose of drinking alcohol. And it was usually hard liquor. Alcohol was often an issue at elections in that, and as a candidate, you had to provide alcohol in order to get elected. Even George Washington realized this when he refused to provide alcohol and he lost the election. So alcohol had a very strong cultural element in our early history. And part of the problem was that there weren't a lot of safe products to drink. The water wasn't really safe. It had a lot of sediment in it, if not toxins. Even milk could be unsafe if the cows ate milkweed, for example. So our early ancestors drank a great deal of alcohol. I like this chart because it really illustrates the fact that in Europe, where a lot of our immigrants came from, has a very high drinking culture. This is today, and you can see that several countries in Europe are still among the most heavily drinking peoples in the world. We actually have a little more moderate drinking climate. In the early days, alcohol was an important commodity for the economy. When farmers east of the Appalachians developed a surplus of corn, they found that they couldn't really ship the corn to markets on the East Coast. There just weren't the adequate kinds of transportation systems. Water, the roads were pretty dicey. So they discovered that if they took the surplus corn and turned it into whiskey, it was much easier to transport. And there was a ready market on the East Coast. And in fact, it became an issue of allegiance to the country because prior to the whiskey being developed, people drank rum, which was imported. Now you could drink a product that was made in your own country and be more patriotic. Another wave of immigrants brought beer and beer making skills. These were the immigrants from the Germanic countries, Germany, Austria, and the like, and they predominated in the 1800s. And by 1900s, really completely dominated the alcohol market. They introduced something called the saloon system. The way it worked was that beer manufacturers also owned saloons in virtually every community in our country. I grew up in a small town called Astoria on the Oregon coast, and my grandmother had some maps of the town in the late 1800s, and I was shocked at how many saloons were downtown. There were a lot of them, and the town was not a huge, did not have a huge population, probably about 10,000 people at that time. And so saloons littered all of our communities, and 70% of these saloons were what's called tied houses, which meant that the large out-of-state beer manufacturers owned them. They were extremely competitive because there were several different manufacturers that had saloons. So you had lots of different saloons competing for the same population. They used aggressive sales tactics, had gambling, prostitution, all kinds of public order problems, and oftentimes they were located near a factory, and of course workers would come after work, and the saloon often would pledge the paycheck so that when the paycheck actually came, there wasn't a lot left for the family. Most of it went to the bar bill. So that system produced a lot of problems. So without much regulation, alcohol was very, very high. And um, most cities and communities did not regulate alcohol. There were some localities that licensed saloons, but it was really for the purpose of getting a license fee. They didn't really have a lot of regulations that were enforced. So eventually, serious social problems existed. This is a quote from a historian, Alexis de Tocqueville, that spent a lot of time in the 1800s observing American life and how things operated. And he was kind of amazed at the temperance movement that began to form because of the serious social problems that existed in America. This quote says, "At last I understood that 300,000 Americans, alarmed by the progress of drunkenness around them, had made up their mind to patronize temperance." And in those days, it was a black and white issue. Either you allowed alcohol or you didn't. There was no thought given to regulation and how you might solve some of these problems through regulation. It was really temperance or not. So the start of the temperance movement began because there was very heavy drinking. Family resources were very strained, and women took a lead in the temperance movement. This is a picture of Frances Willard, who was one of the leaders. Oftentimes, women that were involved in the temperance movement are looked at as kind of cartoon characters, overly moralistic and just wanting to kill the party. But the real reason women took the lead was that family resources were very strained. In those days, women weren't part of the workforce. They raised the family and they were completely dependent on their husband's income. And when the husband drank up most of the income in the local saloon, that created major problems for families. The temperance movement grew and grew. This is a photograph from the Library of Congress that shows the 16th annual convention of the Anti-Saloon League. The Anti-Saloon League grew and took a stand against not only drinking, but the way it was sold. It involved some very competent and clever lobbying on the part of the league, and they moved the prohibition issue forward. So we get to the 1900s, and what we have is a saloon league that is fighting for prohibition, and a lot of in a saloon system that was creating major problems, not only for the family but for public order. There was a lot of drunkenness, public urination, problems around saloons. Then World War II came along, and there was kind of an anti-German sentiment, and the US entered the World War in 1917. And by 1919, the 18th Amendment was passed and ratified, ushering in a period of 13 years of prohibition. Now, prohibition wasn't a complete failure. It did solve some problems, but it also fostered other problems. It really did quell the public order issues. Because alcohol sales went underground, there weren't the same level of public order problems. It also did reduce consumption, at least in the early years, although it crept up, we believe. We don't have actual statistics because it was illegal. We don't exactly know how much alcohol was consumed, but a nationally organized crime syndicates developed to supply alcohol. So you had the introduction of organized crime in our country. Also, illegal retail establishments called speakeasies sprung up to accommodate drinkers, and enforcement was very, very weak. It eventually became quite unpopular. And finally, the 21st Amendment was passed that ended prohibition and gave the primary responsibility for regulating alcohol to the states. Well, it turns out the states really didn't know much about how to regulate alcohol, since it was never really regulated in our country, and we'd just gone through 13 years of prohibition. Fortunately, a large study was financed by John D. Rockefeller, a prominent entrepreneur of the day, called Toward Liquor Control. In this book, the authors, Fosdick and Scott, surveyed a lot of different countries the Canadian countries, other countries in the world that actually regulated alcohol, to identify what are the important aspects of regulation for alcohol control. They also interviewed 400 leaders from all walks of American life to get their attitudes and opinions about alcohol. So what they found was that there was a belief in this country that alcohol could be used moderately and could be a part of civilized living. But people believed that the saloon system must never return. That system was characterized by very aggressive sales that stimulated consumption and was involved in political corruption. A control system was recommended, the recommended process for states in this book. So let's talk about the differences between a control and license system. In the book, Toward Liquor Control, they discuss the elements of both a control and license system. And they did recommend a control system because the authors felt that it would be more effective in eliminating some of the adverse aspects of the profit motive. It would tamp down a lot of the aggressive sales and operate the liquor business from a control or public safety standpoint. But they recognize that most states would probably adopt a license system. In the control system, the state takes ownership of the product at some point in the business cycle. Many states have a privatized retail sector, although some states still have state stores where you buy alcohol. It limits a lot of the adverse impacts of the profit motive and is able to capture more revenue because it takes a share of the profits. And this revenue is needed to combat social problems, which of course still exist today. In the license system, the private sector owns the retail sector and also the wholesale sector. It produces less revenue because it does not share in a lot of the profits like the control system does. And it does not as readily tamp down some of the aggressive sales tactics that increase consumption. But both systems have a lot of similarities. First of all, in both systems, everyone who sells alcohol or serves alcohol is licensed. And this ensures that the criminal element is not evidenced in alcohol sales and service. All licensed systems enforce laws to reduce underage drinking and excessive drinking, drunk driving, and other kinds of problems. All states enforce these laws. And all states, to one degree or another, regulate the days of hours of sale, the location of premises, and those kinds of things. Finally, all states, to one degree or another, have a three-tier system and require that all alcohol flows through a three-tier system. So today, this is what we have. We have shared principles of both a control and licensing system that help curtail problems and keep an orderly alcohol market. We have background checks and other requirements that keep the criminal element out of the business. The three-tiered system, which all states have, it's a closed system of product sale, which requires that alcohol manufacturers sell only to a licensed wholesaler who only sells to a licensed retailer. There are a couple of advantages of that system. One is that the wholesaler in most states collects the excise tax, and it's a very efficient system whereby we have almost 100% tax collections. In other countries, they lose as much as a third of potential revenue through leaks in the system. A three-tiered system is a really good system that provides very strong tax collections. It also helps prevent tainted products from getting into the marketplace. The wholesaler in most states is required to track every bottle and can. Wholesalers are also in retail establishments looking at what's on the shelf. That provides a very good tracking system. So when there is a recall or a problem, it can be quickly identified and pulled from the retail shelf before there's a problem. Recently, we've had some recalls of bottles with the problem of glass falling into the interior of the bottle. Those products have been so quickly removed from the shelf that no customer has been injured by the recall. In other countries, fake alcohol often gets sold in the marketplace, and fake alcohol sometimes contains methanol, which is a very deadly substance. A few years ago, over 30 people died because in the Czech Republic, a fake vodka was sold, and many people drank it, bought it. It was very cheap. They bought it, they drank it, and over 30 people died. And then they had to prohibit the sale of hard liquor for a period of time until they were able to identify all of those fake products and pull them from the marketplace. So not only were human beings harmed, but businesses were harmed because they had to stop selling all of their products for a period of time. So the three-tiered system is really a good system that protects the public. All states have enforcement activities that prevent sales to minors and curtails a lot of the kind of excessive drinking and business practices that happened before Prohibition. All states limit availability of alcohol to some degree. Before Prohibition, local communities were completely saturated with outlets, and there was almost no regulation of location, product, hours of sale, and that kind of thing. And as we'll see, research has established that those are effective methods of control. Let's talk a little bit more about control systems. They aren't that unusual. We're not the only country that has a control system whereby the public owns part of the business and sells it in a very controlled manner. Control systems are found in other parts of the world: Canada, the Scandinavian countries, in India, and so forth. They tend to predominate in northern countries. Drinking is higher in northern countries, and there are various reasons for that, culture and so forth. But we recently had a study that showed that cold weather also induces increased consumption. In the US, control systems also predominate in northern states and communities. There are now 17 control states, and you see they're kind of clustered in various parts of the country. And we also have some states where the control system exists in local governments, in Minnesota, Alaska, Maryland, and South Dakota. Local communities have control systems in their area. So what does research say about control systems? And I use a couple of different very credible sources for research. One is the Centers for Disease Control, which has confirmed that that control systems are highly effective and recommends against further privatization of those systems. But another publication called Alcohol, No Ordinary Commodity is produced by the leading researchers around the world, and they have identified what they call the strong strategies. And those are that restrict affordability, that restrict availability, accessibility, and reduce drunk driving. So the other thing to remember about control systems is their revenue generating capacity. Control systems generate 82 to 90% more revenue than licensed systems. And given that alcohol harm is not covered by alcohol taxes and fees, revenue raising is really important because it offsets at least part of the cost to the general public. Let's talk a little more about the strong strategies. Affordability. Price is the strongest controller of consumption. As the price goes up, consumption goes down. As the price is lowered, consumption goes up. You can kind of count on that. But jurisdictions do need to essentially balance the price, because if it's way too high, then it induces bootlegging. If it's way too low, it increases consumption. So alcohol regulatory authorities are always looking at where is the sweet spot that balances these two aspects of price. Promotions induce sales and encourage consumptions. Because control systems own the product, they have better control of promotional activities. In Oregon, where we owned the distilled spirits business, we did not allow any advertisement of the product. Certainly national companies were free to advertise their product, but as a liquor retailing system, we only advertised location of stores and that kind of thing. So you can really curtail a lot of the issues that will increase consumption of alcohol. Products. Dangerous products can be curtailed or kept off the marketplace. For example, Washington State used to be a control system. It's the only state that has privatized. But before privatization, it required that you have a special permit to buy a high alcohol content product like Everclear, which is almost 90% alcohol. So also jurisdictions can delist what might be dangerous products. I remember that in Oregon, we chose not to list a product called Russian roulette vodka because we thought that conveyed the wrong message. We have plenty of problems with alcohol and violence and death, and we don't want messages that acknowledge or encourage that. Finally, I wanted to talk a little bit about location. When you own the alcohol business, you do really control the location. And so you can locate them, your stores in appropriate places, like not near a school, or you can choose not to have it like they did with the saloon system, where you locate a lot of stores near a factory where people will come and buy alcohol after work, kind of thing. So basically, as a kind of summary, the goal of a control system, as well as a license system, is to balance business and public safety. We have to remember that despite the fact that we assert substantial control over alcohol, it still accounts for 88,000 deaths annually. That's a lot of harm to our families. And so we have to be very careful about selling the product. Also, drunk driving, we have made a lot of progress on drunk driving. It used to be 3 times the number of deaths that we see annually, but we're kind of stuck at the 10,000 death level, and it's begun to sort of creep up. We also have 290,000 injuries each year, and some of those are very, very serious and create enormous health bills. Alcohol harm costs everybody. It is estimated that it costs $249 billion annually. And as I understand, only about 40% of that cost is paid for by taxes and fees on alcohol businesses. So it doesn't come close to covering the total cost. But alcohol businesses are also important for our economy. However, public health and safety are primary, and we need to always remember that. And many times you can go to your statutes and realize that your first duty is for public health and safety. But secondarily, businesses need to be well run, and people, as it creates a lot of jobs and profits for the community. So here are some takeaways. First of all, history has shaped where we are today. We have 2 kind of extreme examples of experience with alcohol. One is no regulation that created eventually very serious problems for our communities and our families, and then prohibition, which, although it reduced consumption and some problems, it fostered the development of organized crime and eventually became very unpopular. So after Prohibition, the 21st Amendment granted the states the primary responsibility to regulate alcohol. And I think that kind of recognizes that a federal law where one size fits all just doesn't work very well, that you need to be a lot more flexible, and particularly states and communities need to have a major say in how alcohol is regulated, because when you have alcohol problems, they are really at the local level. And getting the federal government to intervene in localities is is difficult and probably not very workable. Certain principles do transcend. All states license everyone that sells alcohol, and all states aim to reduce illegal and excessive drinking. All states also use a three-tiered system, which collects maximum revenue for us and protects us against tainted products. So it is a really good system and worth retaining. Um, Regulatory systems do vary to the extent of how much privatization controls. Licensed states allow the private sector to operate the retailing of alcohol. In control states, the public owns part of the alcohol business, usually the wholesale system, and in some cases, the retail system. But it allows the public to enjoy part of the profits of the sale of alcohol and use that money to offset some of the harms. It also, in a control system, we also are able to make greater use of the strong strategies. That is to control prices, promotions, products, and places for maximal harm reduction. License systems are usually a little less effective in controlling alcohol problems, and they produce less revenue to offset the harms of alcohol misuse. So I want to thank you so much for listening today. And I want to go through a few resources that I would recommend for you. There are actually a lot of works on alcohol history, but there's one that recently came out by Bill Rorabaugh, who is a professor at the University of Washington that specializes in alcohol history. He wrote a little 100-page book on the history of Prohibition. It's an easy read rather than slogging through a regular history text, so I would recommend that. Also, Okrent recently produced a book on the rise and fall of Prohibition. For alcohol regulation, Toward Liquor Control is now available in a reprinted version from the Center for Alcohol Policy. It's written in language that people used right after Prohibition, and so it is a little difficult to read, but if you can at least skim it, you will be amazed at how closely both our license and control system followed the recommendations in this book. Also, there's a book by Carol Jerkowitz and Murphy Painter on why we control alcohol the way we do. I want to recommend some research resources for you. I mentioned the CDC and the Community Prevention Services Task Force. They review evidence-based findings. They look at very credible research sources and make recommendations on various alcohol policies that they have deemed effective based on credible research. Alcohol, No Ordinary Commodity, has a very helpful matrix in the book that shows not only the effectiveness based on research, but also the cost of implementing these kind of policies. I mentioned Dr. Namey in this set of references because he and his colleagues have started looking at alcohol systems Research has typically been one regulation at a time. But what we really have are regulatory systems where regulations work in tandem with one another. So he has developed a scale of strong alcohol policies and then tested every state based on this scale. And he has found that the stronger the scale, the more likely are able to control problems like underage drinking, excessive drinking, and DUI. So that's a very good resource. Also, Raymond Zullo has looked at the impact of control systems and has documented the fact that control systems raise substantial revenue. So this is my contact information. I have a website where I publish all my materials, and I just, within the last week, issued a new short report on college drinking. We've made a lot of progress on underage drinking, but mostly that progress is for younger kids. For older, underage kids and college students, we've reduced it a little bit, but we still are stuck at very high levels of not only consumption, but excessive and binge drinking. And that leads to all kinds of problems. So now I'm willing to accept any kind of questions that people in the audience might have.
All right, Pam, thank you so much. Now there are a few questions that I have for you, and the first one is from Michael. When you referenced European immigrants, are you including our founding fathers? They too were European immigrants who drank heavily for many of the reasons you've described.
Yes, I am including them. As I noted in one of the early slides, George Washington refused to supply alcohol, and he lost the election. And the next time he ran, he supplied alcohol. The founding fathers were drinkers, and some of them drank fairly heavily. So I would include them in that.
Okay. The next question I have is from Skylar. Do you think that the federal prohibition on cannabis has been injurious to the implementation of a three-tiered system being applied to cannabis?
Well, I know that some states have tried to put together a three-tier system. I think Washington State felt it was fairly important, but um, I don't know that any of the states have a three-tiered system that's exactly like the alcohol system. Um, it, you know, it, it's kind of a mishmash out there. I'm not an expert on cannabis regulation, but I do kind of follow the details. And every state does it a little differently. And you know, I think that a three-tiered system is certainly a safeguard. And I know that states are intent on tracking the product from seed to sale. Sometimes that's successful, other times it's not. I think that people are really struggling with cannabis regulation.
Okay. The next question is from Karen, and the clarification is when you said revenue is higher under the control systems versus licensing, do you mean revenue for the state? I imagine that businesses make less revenue under the control model.
Well, that may be the case. I haven't seen data from the business side. When the state is the owner of a business, the owner takes part of the profit, leaving less profit for the retailers that it hires. I think that all in all, everybody makes a pretty good living from alcohol, but it's probably true that the pub, when the public sector takes part of the profit that license states um, gives to its business owners, I think that's probably true.
Okay. And this question is from Jennifer. Do you have references for statistics comparing control states to license states regarding issues such as DUI and accident rates and illnesses associated with alcohol use?
Well, I would recommend the studies by Tim Namey. He looked at it a little differently. Um, he developed a policy scale of policies that are effective, and one of those policies is a control state. But the stronger the alcohol policies, which means the more you have the strong policies and use those policies, the fewer problems that you have. And he made a statement in one of his articles that states could strengthen their policies and achieve a reduction in alcohol harm if they could garner the political will to do so. So I think that's an important consideration.
Okay. Now, you may have answered this already, but this question sounds a little similar. Do you have any confirmation if prices actually are less in licensed states from control states? And if so, how much less?
Well, prices are impacted by a large number of factors. Um, let me take Washington State, for example. Washington State, before they privatized, had the highest spirits prices in the nation. Oregon was number two. Um, when they privatized, the promoters of privatization really thought that meant that prices would be lower because they've generally thought that government was inefficient and prices would just be lower through efficiencies. But that didn't happen at all. One of the things that Washington State ballot measure writers, and they were mostly, as I understand, lawyers hired by the Costco Corporation, they had to, decided that they wanted to promise the state would not lose revenue. But the only way to do that was to add fees, which normally would be called taxes. And as a result, after privatization, Washington still had the highest prices for spirits, and on average, the prices were $2 a bottle higher than they were before privatization. And that was due to the fact that they added fees to ensure that government entities retained the same amount of revenue, which they did. So there are just so many factors. There are some licensed states that assert very tight control over alcohol, and so their prices might be a little higher. There are some control states that are very good at merchandising and selling, and they may use prices um, to induce sales. It's a very, very complex uh, set of factors that generally relate to the overall price. But on the whole, I believe that prices in control states are higher, and they do that in order to capture as much revenue as possible to offset the cost of harm.
Okay. So just two more. This one is from Denise. What are your recommendations for community organizations that are trying to keep alcohol state controlled?
Well, I think this is kind of a first step. It's as you probably realize by now, both license and control systems are pretty complicated. They involve a whole system of regulation. But the basic difference between a control and a license system is that control systems generate more revenue because they own part of the marketplace, and uh, they also can make greater use of strategies that are better at controlling alcohol harm. Any state that looks at privatization, one of the first obstacles is how do we replace the revenue that we're going to lose by privatizing? Because there's almost no way to privatize without losing revenue unless you put measures in place to increase taxes and capture the same amount of revenue like the state of Washington did, um, which means you're going to drive up prices. So I think it's important for public officials to understand the advantages and value of a control system. Um, I think North Carolina is facing that issue today, and North Carolina has a very good record on levels of consumption uh, and other kinds of measures like that. And I know that community members are looking to publicize that information. And also, they're looking at how on earth are we going to replace the revenue that's lost, because a substantial portion of the revenue goes to local governments, and they would be basically out of that revenue. So I think coalitions can be very, very effective. And it's really important to change the conversation from just being a conversation about jobs and local businesses, but also to include the public health and safety issues of alcohol control.
Okay. All right. And the final question actually is well, whether this presentation is being recorded, and yes, it is, and it will be available. So, Pam, want to thank you very much for your time and for sharing your valuable knowledge with us. And thank you all for joining NABCA on this webinar. If anyone has questions that we did not address, or if you think of something afterward, feel free to email me. You can also please visit the NABCA website, www.nabca.org, for various resources, including white papers, previous webinars, and other materials. We would like to get your feedback about the session, and we'll soon be sending you a quick survey to complete. Also, let me know of suggestions for future NABCA webinars. It is our goals to give you the education and tools that you need to perform your function effectively. So wishing everyone a great day. Thank you, and have a good, and goodbye. Thank you. Bye.
Bye-bye.